Welcome to Truly Heal. Would you like to become a certified functional medicine health coach? Long title, but welcome to the most booming business in this world. When you look at the dynamic in healthcare, you can see that hospitals stay the same. Then you have doctors' outpatient offices increasing, but home and healthcare and outpatient care centers are increasing dramatically. And that shows a population which is more inclined to look after themselves and help themselves than ever before. This second chart here also shows that the public health care, which is the lower dark blue part, is reducing, and the self-help, the personal investment, is getting bigger, especially in America and many other countries as well. So if you're in Switzerland, Canada, Belgium, Australia, Greece, you will have a lot of clients that work with you and are inclined to do so. Now, we live in a world that is becoming more and more sick the more developed we are. If you look at Western Europe, Australia, New Zealand, Northern Europe, North America, Southern Europe, these indicate that there is a high tendency for breast cancer. And the further you go into the less civilized countries, less cultivated countries, disease goes down. So what we do with our food, with our industry, is certainly not helpful for the human body, which means you have a lot to do. And if you then add, in this world of pain, diabetes, depression, ADHD, cancer, again, diabetes, and then autism, which is going through the roof, you notice that with the education that you learn in this program, you can address all of those diseases because you're not working on the disease, you address the root cause that triggers this disease. Now let's just look at some of those factors. All of those things can be easily avoided if you know what is right and what is wrong. Work stress, social stress, financial stress, relationship stress, all of those impound on your health. And then you have health stress. And we have a big focus in all of those areas, but health very predominant. We look at teratogens, carcinogens and mutagens, different types of toxins that influence the body, hormone disruptors, heavy metal, pesticides, fungicides, herbicides, neurotoxins, and then also deficiencies, infections, dysbiosis, hypoxia, inflammation, acidity, and so on. So we cover a lot of ground. We look at the whole lifestyle and the diseases that can come from that. Now, a doctor will never have the time to do that. They look at the symptom and then they give you medication to suppress the symptom. And it's fair enough. With their practice, they have to have 10 to 15-minute doctor visits to even break even. So you can't blame them, but it is certainly not what patients need. They need someone who listens. And not everybody has the ability to work with a doctor who takes the time and works through with all of those things and then charges you $30,000 for a 3-week stay. So a health coach would bridge that area right in the middle and develop a lifeline of events. And this is something very important to understand where disease comes from and how it grew into what it is today. No disease happens overnight. It is actually a gestation process that shows very clearly once you go through this process. And someone who listens and digs deep to find all the underlying causes makes a person sick. Someone who sees the whole and not only parts. And that's where you come in. You're the missing piece of the puzzle. You're the one that will help your clients to understand and offer a solution where to go. And there is a lot to do, so let's get started. One of my favorite slides of all is responsibility. And think about the word. I am able to respond to your questions. So if a client comes in and asks about different tests, I'm able to respond. I have also knowledge about all the different treatments, side effects of different medications. And a lot of patients come in, they have so many medications that when you look at the side effects, that's the main problem that they complain about. What kind of diet is ideal? Is it really true that a ketogenic diet kills all cancer? Well, maybe not. We need to understand the physics of the body to understand if it actually works. Then what kind of exercise? What kind of toxins? How do we test for oxygen? How do we get rid of those different types of toxins? Stress and trauma. where is it located, when did it start, what suppressed my immune system. We look at lab results so that you understand how to read them. Then hormones, very important, hormone-related cancers. You need to understand what hormones do and where they come from and how they can be repaired. Deficiencies, we live in the land of plenty and we're starving to death. One of the sentences Burton Goldberg said, and it's in my mind, our nutrient density of food is so little if you buy conventional food. So how to supplement that, how to change, how to find the right source, very important. And a lot of patients come in that are feeling unwell, that you need to help to overcome, the side effects of treatment, the side effects of medication. So it's a huge responsibility that you gain from this program by learning about all of those different factors. And that was functional medicine is all about. Now let me give you a short overview how the process works once you're finalized with your training. You would work with your client through a questionnaire which doesn't leave a stone unturned. And this is important. You will learn how to look for the disease by going through their history. And that means mother and father disease history, condition at birth, early childhood, then adult life, inherited problems, environmental factors, medication present and past, including side effects, symptoms, habits, lifestyle, digestion, diet, milieu, stress, trauma, and so on. It's a vast list. And as you work through with your client, and especially if you've done it a few times, it will open up and you will read, this is how it all came about. And that is then confirmed with tests. Now, a coach cannot diagnose or prescribe, but a coach can see, look, these are the main factors that really build up into the disease, and why don't we test? And there is today so many laboratories that provide the test to end clients, and then you can, together with your clients, sit down, listen to the analysis and their recommendations how to get rid of toxins. So building this into our program has advanced us drastically. Also, when you look at some of those tests, like the GPL tox is recommended for the following diseases. Look at the list of diseases. Now, these are non-heavy metal toxins. Wow. So where do they come from? How do they surround us? How we have ingested them? What are the best ways to get rid of them so that the disease doesn't need to come back over and over again? Now, once you have your test results and you have your analysis from the first place, it is easy to create a written report, including timeline, showing priority areas that should be addressed first to have the fastest results. And we're always looking to combine some of those areas into treatments that cover many of those factors so that you don't have to have a gadget for every single thing. We really try to bring treatments in which cover the root basic of those diseases. Now, when you think about all of that, wow, this is diligence, right? If you take that out of books and out of folders and you make your own charts and maps, it's hard work, especially if you have something not appearing with every patient. Until you remember and you go back to it, it's usually lost. And that's what we call specializing, because you lose the overview. Now, that won't happen with the Truly Heal app. We've packed everything you need to know into the app, and I've created a separate video that will explain the whole process. Actually, it's just a huge mind map that covers all the different problems, then the disease, then the symptoms, then the treatments and tests and supplementation, all into one category. And you have that at your fingertips. So it makes it very easy to be able to respond. Now, functional medicine coach is to guide, motivate, and educate. And I would really like to just stand out one point. It's a bridge between doctor and patient, because patients are usually way overwhelmed to tell the doctor what they need to know or what they need to do. And the other way around, doctors use words and vocabulary that often overwhelms the patient. So if you're in the middle and you understand the test results, you understand the process, and you can communicate that for your clients and also direct where to go. Not one doctor does it all. There is always many doctors who offer different specialty treatments, and how to build that into a proper protocol. This is actually a phenomenal task. Now, treatment and therapy so far The base treatments like detoxification, all of that was not included. Coaches couldn't do that. Coaching license has nothing to do with the treatment or practitioner license. Now we've developed the Truly Heal clubs only for our health coaches, and that gives them the opportunity to work on those baseline protocols with their clients to get rid of toxins, to energize the system, and to use treatments which are not commonly used in any doctor's practice. Now, is this program suited for you? Only if you really want to dig deeper into the root cause of disease and help your clients resolve them. If you want to learn how to support the self-healing mechanism that is inherent in every human being, and like Charlotte Gerson said, if the body heals, it heals. And that's true. If you remove the root causes, the problems, then everybody heals. As a wellness detox spa operator who is passionate to provide a more complex solution or service, a patient, family member, a friend who wants to support or take responsibility for their own health. And we have many, many cancer patients who took on the task, or husbands or children, to look after their parents and better understand how they can help. And this is very beautiful. Or as a nurse and healthcare worker, where you look for more, you know what I mean. No prior or prerequisite education necessary. You can always start this course. You know me, and we're really trying to keep everything logical, simple, and straightforward. No fluffy words, no complicated assignments. Logical and clear, and if you can do that, you are home and host. You're really enjoying this program as a personal self-development program. Where can you work as a health coach? Very simple, anywhere. It really is from home, from online. You can do online consultation, you can do professional setting with a doctor or clinic, or you can work with a self-help group or a community that tries to overcome cancer or Lyme disease or anything and support them. You can work in a health retreat, yoga and fitness studio, offer workshops and health clinics just in the same way as I do, or open your own Truly Heal club once you are certified. Now the program takes 1 to 2 years, normally about half a year to a year. But we allow you 2 years in case you have a break or you miss out. But we encourage everybody to go through in one flow so that you don't miss out or forget the beginning once you reach the end. There's about 100 to 150 contact hours, deliveries online, IT requirements, anything that accesses the website. It's 47 chapters with short responses. So if you go through a lesson, you just answer a little quiz at the end so that we know that you've understood and that you realize what's in it. And the course contains a mid and final exam, which includes a couple of case studies. So you pick a friend or family member that you study through so that you can do your exams with them. A patient evaluation and a short video recording, how you introduce and how you explain what you do to them. And access to a teacher for problem, guidance and questions. This is probably one of the biggest advantages because you passed with 60%. The other 40% are missing and the patient, well, bad luck. We try to get you all the way. So every assignment is corrected to 100%. And it makes sense. When you get an answer wrong, we send you suggestions, or our teachers send you suggestions, things to look up until you get it. And this will give you so much confidence and not come out and say, I just barely passed it, but now I can work, and then miss out, or we pass on this neglect to the patient. We really try to get you there, and that is also then certified. We've been now platinum member with the IICT and can provide you afterwards with insurance and a certification that allows you to work safe and protected. If you look at 380 per year with public liability, product liability, professional indemnity, that you're protected with your work. Now, what do I get when I sign up today? Very simple. Instant access to your teacher. So your teacher will contact you after sign up, will get you started. You also get access to the online material right away and will sign you up to the app. You also, when you're finished, you get a listing on the Truly Heal website and a special rebate. So if you want to buy some products now, rather wait until you signed up or you went through the first exam with your health coaching program, because that will allow you then to get better discounts either for yourself or to sell on to your clients. Now, I don't like it when they go like, it's $60,000 in today only, so we kept it pretty marginal. The program will go up with the next launch to $559. We have the app, $1,280. We have personal teacher access, which is on the hours counted that you use them and work with them. So $2,490 is normally $9,000. The website price officially is $659. So we've reduced it for the spring launch to $5,000 even. Now, if you want to go into a payment plan, we add 10%. Therefore, you have the possibility to pay it off in a 6-month payment plan. And if you want to join, do so right now. For the spring opening, we take 20 new students, 20 new coaches, because our teachers need to be able to work with you and have plenty of time. Question and answers. And I guess you have plenty, but I'll tell you the ones that we have quite regularly. Can I really learn all this? You know, when I went through, I had the same problem. It was like a lot and the test, and then I forgot, and then I was reading through half a year later, and I was like, oh God, I didn't remember that I still knew this. So we lose different things out of our memory, short-term memory. And that is why I've actually created the app and put so much effort in so that it's all there. Then we have the questionnaire, which guides you through, and you have always your answers and all your back end available at any given time, responsible. You are able to respond. And that is something that is very valuable. It's not disappearing and then you don't know where to find it. It's all there. I'm scared of tests and assignments. Don't worry about writing, grammar. As long as you don't copy and paste and formulate it yourself, you will always manage. You can open up the test and then answer at the same time in a parallel screen, very easy. I'm not healthy enough to be a health coach to others. Well, but you are an inspiration by trying and by doing the best you can to get there. And therefore, that encouragement is probably more worth in knowing where the patient is and gives you more empathy. So that's definitely not a disadvantage. I'm too old to change career. Well, if that's what you believe, then it is so. But there's many people, including me, who have changed career at a very late stage. And because it is something that I love doing, well, I'm thriving and I do really well. So I think it's the same for everyone. If you find what really fits to you, there is no age-related change requirements. I'm scared of the responsibility. We talked about that quite intense. You are able to respond by using the app and by being able to go through the questionnaire. And that gives you so much information at hand that you use every time with every client that you will be definitely able to respond to all of those questions, probably a lot more. Can I get into trouble with the law? No. If you don't do things that you're not allowed to, like give injections and prescribe documents and tell, don't go back to the doctor or drop all your medication because I don't think you need it. Well, these are certain things that you can't do, but we'll teach you exactly what you can and what you can't in order to keep you safe. And is there a payment plan? I just mentioned that. Yes, there is. It's an upfront payment and then the rest is divided by 5 more months. All right? And now, join us. We only have limited space. We don't take endless coaches and we don't take them on all the time. We open up for 3 times a year. And when we take on coaches, we work through with them all the way until they are certified. So click the button below, select either payment plan or once-off payment, and we'll see you in our training area.